I'm John Strum, and this is Real Talk MS. It's October 18th, and we have a lot to talk about. But first, I have something I want to share with you. If you're a regular listener, then you know about the Real Talk MS listener hotline. It's something that I set up a few years ago so that if you were someone who didn't want to send an email, you could just call and leave voicemail with your feedback or suggestions for future podcast episodes. Well, last week, I received a voicemail that just made me smile. And in a moment, I'm going to share it with you. Now, the caller didn't know that I was going to share this, so I've preserved her anonymity by bleeping out her name at the beginning of the message. But other than that, I haven't changed or altered anything else in this recording. So here it is.
Hi, this is I live in Maryland. And I just wanted to say that I listened to your show. I hate to say this, but I have insomnia, and I thought, oh, great, this ought to put me to sleep. Well, I want you to know that the wealth of information that I heard, I never went to sleep because the information was current, fast-moving. You love statistics, and you have a way of getting it in there and keeping it moving. And I can't wait to recommend your show to many people that I know have MS. Thank you for a great show. Keep up the great topics. And just wanted to say thank you and have a great day. Bye-bye.
So this very lovely woman decided to start listening to the podcast because she was hoping it would put her to sleep. I'm glad we failed that test. And I want to thank her, without using her name, for sharing her experience and her very kind words. Who knows? This may become the new tagline for our podcast. Real Talk MS. We won't put you to sleep. In any event, I guess I'll take this opportunity to remind you that you can share your thoughts about the podcast with me, your feedback on episodes that you've listened to, or maybe suggestions about episodes that you'd like to hear. Email your thoughts and ideas to John Strum, that's JONSTRUM, at realtalkms.com, or call the listener hotline at area code 310-526-2283. I always love hearing from you guys. If you're on Medicare or you get your health insurance through the healthcare.gov marketplace or through your state's health insurance exchange, then you probably know that the annual open enrollment period is about to get underway, or in some cases is already underway. A lot of people tend to go through open enrollment on automatic pilot, assuming that the health insurance that they had last year will continue to serve them well next year. But that isn't always true. Policies change, deductibles change, physician networks change, and prescription drug formularies often change. If you're living with MS or really any chronic illness, you literally can't afford to be on automatic pilot when it comes to making decisions about your health insurance. Those decisions can end up costing you a lot in time, in money, and heartache. A few moments spent carefully considering next year's health insurance plan, well, that could be the very best investment of time you could possibly make. Joining me today to talk about the kinds of things you want to carefully consider during open enrollment is Nicole Vasquez. Nicole is one of the National MS Society's MS Navigators, and I've said this before, but it bears repeating. I think the MS Navigator program is the gold standard when it comes to offering personalized professional problem solvers to help you navigate the sometimes choppy waters that you sometimes land in when you're affected by MS. Every year during open enrollment, MS Navigators help a lot of people make the best decisions for themselves and their families, and I'm thrilled to have Nicole join us today. But before we get to my conversation with Nicole Vasquez, there are a few other things that you should know about. Most of you know that my wife lived with a particularly difficult case of progressive MS for 23 years. I served as her caregiver and advocate during that time, and one of the reasons I started this podcast was to share news and information about research that would improve the lives of people living with MS. Well, I also have a keen interest in improving the lives of MS caregivers, the spouses, partners, family members, and friends who provide support to a loved one who's living with MS. So for close to 2 years now, I've been working with iConquer-MS, the People-Powered MS Research Network, to develop a toolkit for MS caregivers. And I haven't been working on this alone. I'm part of a remarkable team of MS caregivers who have provided their insight and opinion in developing this toolkit. And we're at a point in our work where we really need the input of more MS caregivers. So I'm hoping you'll do me a quick favor. If you're an MS caregiver or you know an MS caregiver, it would mean a lot to me if you'd spend about 5 minutes completing an online survey. Getting your opinions will help ensure that our toolkit offers the right resources to help resolve the issues that are most important to MS caregivers. This survey is completely anonymous, and rather than rattle off a long, complicated URL, I've created a shortcut that I hope you'll find easy to remember. Just visit realtalkms.com/caregiver, and you should find yourself at the survey. Now, the URL is mine, but the survey isn't. It's being administered by iConquer-MS, and again, it's completely anonymous. I want to thank you in advance for investing 5 minutes of your time in helping to create an MS caregiver toolkit that we hope will provide the right answers to the right caregiving questions before those questions even arise. Again, you'll find the survey at realtalkms.com/caregiver, and I'll include that link in today's show notes. Last week, the U.S. Supreme Court cleared the way for generic drug manufacturers to begin offering a generic version of Gilenya. A lower court had previously found that the patent for Gilenya, held by pharmaceutical manufacturer Novartis, was invalid. Now, while Novartis may choose to appeal that ruling to the Supreme Court at a future date, this ruling by the court lifted a ban on generic versions of Gilenya. Now, Gilenya is a once-a-day oral disease-modifying medication that received FDA approval for treating relapsing remitting MS in 2010. Last year, Gilenya was Novartis' third highest-selling drug, with sales totaling $2.8 billion. I'll keep you posted as to when the generic version of Gilenya is available in the United States. Biotech company Neximmune is partnering with the National Institute of Neurological Disorders and Stroke to develop a new cell therapy designed to destroy B cells carrying the Epstein-Barr virus and human T-cell leukemia virus type 1. Earlier this year, you might remember, a Harvard research team was able to show that the Epstein-Barr virus, or EBV, triggers MS. Now, I want to explain that about 95% of the world population is carrying the Epstein-Barr virus, and very obviously, 95% of the world population does not have MS. So there's something else going on. There's something else at work among people who are living with MS. But 100% of the people living with MS do carry the Epstein-Barr virus, and scientists have speculated that eliminating EBV will eliminate most of the MS in the world. This new cell therapy is based upon nanotechnology. And if you aren't a science fiction fan, you may not be familiar with nanotechnology. It's science, engineering, and technology conducted at nanoscale. It's the use of very, very tiny particles that are smaller than anything you might imagine. Consider that there are 25,400,000 nanometers in an inch. A sheet of newspaper is about 100,000 nanometers thick. And what NexImmune is proposing is to collect a patient's own T cells from their immune system, enrich those T cells with nanoparticles that have been created and programmed to hunt down B cells infected with Epstein-Barr virus and destroy them. Then these enriched T cells are reintroduced into the patient's immune system where they begin their work. It may sound like the plot from a science fiction novel, but it's technology that exists today. You can be sure that we're keeping an eye on multiple efforts currently underway to hunt down and destroy those EBV-infected B cells. When that happens, it could represent a massive step forward in ending MS. Too many people with MS have stories about the long and difficult road they faced in getting their MS diagnosis. So imagine a quick, inexpensive, and reliable method for clinicians to screen a patient in their office and then send along only those people who were very likely to have MS for final diagnostic testing and confirmation. Well, a research team at the University of Illinois may have developed a system that could make that scenario a reality. They used a simple digital camera to record video that captured very subtle changes in a person's gait, and then developed a machine learning algorithm that could analyze that video and determine whether someone might have MS or Parkinson's disease. In their study, the researchers recruited adults with and without MS and Parkinson's disease. The study participants walked on a treadmill while a digital camera shot video of their hips and legs. The study participants were also asked to walk on a treadmill while reciting every other letter in the alphabet, so that they more closely mimic the real-world challenges of walking while you're thinking of other things and not just concentrating on walking, as is often the case during a neurological exam. The algorithm evaluated the body coordinates for hips, knees, ankles, the big and small toes, and heels, and with a success rate of about 75%, was able to identify which study participants had MS, which had Parkinson's disease, and which had neither. This is just one more example of how artificial intelligence will change the practice of medicine. We're going to continue to see machine learning algorithms play an increasingly important role in assisting clinicians in diagnosing MS and other health conditions. If you'd like to review the details of this study, you'll find a link in today's show notes. And while we're talking about visiting the clinic to see your neurologist or MS specialist, one of the things you want to be sure of is that those important members of your care team are covered by your health insurance. Insurance companies change which doctors are in or out of network. They reshuffle the prescription drugs on their formularies, and they often make adjustments to the deductibles that we pay. That's why it's so important to do your homework and pay attention to those changes during open enrollment. MS Navigator Nicole Vasquez joins me in a moment with some great information and resources that you can use to successfully navigate through open enrollment and make the very best insurance decisions for yourself and your family. In a moment, we'll meet my guest, Nicole Vasquez. The annual open enrollment period for health insurance is right around the corner. This is your once-a-year opportunity to make changes to your health insurance plan or even enroll in a new plan. And when you're living with MS or any chronic illness, this is a decision that can have a major impact on your health and your finances in the coming year. So choosing wisely is key. And joining me today to help us navigate the sometimes choppy waters of open enrollment is Nicole Vasquez. Nicole is one of the National MS Society's MS Navigators, and if you're a regular listener, then you've heard me talk about the MS Navigator program before. I think this program is, in a word, remarkable. To me, it represents the gold standard when it comes to really unparalleled one-on-one support. So I'm thrilled to have an MS Navigator joining us again this year to help us figure out what we need to be thinking about and what we need to be doing during open enrollment. Welcome back to the podcast, Nicole.
Hi, John. I'm so glad to be back. Thanks for having me.
Let's start with a quick review of the basics. What are the main
Gotcha.
sources of health insurance?
Right. So I think of them in kind of buckets. So you've got the biggest bucket for most people here in the United States. That's going to be their employer or group coverage, whether that's through their current employer or their spouse's employer. So those big group plans. Then another bucket is going to be individual coverage. That's marketplace insurance, something that you go and you buy on your own. And then the third bucket are going to be our federal or government benefit programs. Those are Medicaid, Medicare, and a smaller portion VA.
What kinds of things should people consider when they're choosing a health insurance plan? And are there any special considerations that people living with MS should keep in mind?
Yep. The thing that I would say I hear the most are people being concerned or missing the ball on getting that prescription coverage for their medications, whether it's their MS disease modifying therapy or maybe one of their lower ticket treatments for symptoms or another diagnosis. So that would be one thing to look at. Another thing that people really consider or want to make sure that they have in mind is, are your medical providers going to be part of your insurance coverage next year? Are they going to be part of the plan's list of preferred doctors or providers? And then things like, do you need regular or occasional infusion treatments? And what are those costs going to look like? Things like MRIs, blood tests, all of those different things that come up for people with MS on a more frequent basis than somebody in the general population.
So you really want to be thinking about the kinds of things you typically use in terms of your ongoing healthcare.
Absolutely. Absolutely. What's on your list of priorities?
Well, as you just mentioned, insurers expect you to use doctors who are part of their plan or in network. And if you wander outside of their network, well, you can end up paying a very hefty price for that. Right. Now, if you already have a neurologist that seems to be a good fit, how can you determine whether they're part of a particular insurance company's network? How do we know who is or isn't in network?
Sometimes that answer can be harder to find than others. For someone who has a high priority of keeping their provider or providers, what we're going to suggest is to contact that policy specifically and ask them if that doctor is going to be in their network for the next contract year, for the next coverage year. And we're also going to tell you to contact your provider and ask them if they're going to take that insurance policy, not just that company, but are they going to accept that policy? I can give an example. You could call your clinic, your neurology clinic, and ask them if they're going to take Blue Cross Blue Shield next year. And they could say yes, but they may not take the Blue Cross Blue Shield plan 24685 that you're signing up for, right? So they answered you, but they didn't give you the answer that you needed. Another thing, though, that you can look into, too, is that if you have a type of plan that is a preferred provider network, you could kind of be in between. So your doctors may not accept, or that plan may not have your doctor on their preferred list of providers. So they'll still cover some of the cost, just not as much as if your doctor were a preferred provider.
So tell me, what are the open enrollment dates this year?
For your doctor or for your employer coverage, that's going to be up to the employer. That's going to vary. Each employer sets their own open enrollment dates. For the marketplace this year, For the federal marketplace, we know for sure that that's going to start on November 1st and end on January 15th. But for somebody with a marketplace plan that wants their coverage to start on January 1st at the beginning of the year when your other coverage ends, you have to be enrolled in a marketplace plan by December 15th. If you live in a state that has a state-run marketplace, you could have a bigger window of opportunity for open enrollment. So you'd have to check with that state marketplace to see if there's other dates available to you. And then finally, Medicare open enrollment starts October 15th and is going to end on December 7th.
So I think what I heard you saying in your answer is not every state uses the federal government health insurance marketplace. Some have their own marketplace, right?
Correct. And the easiest way to figure out if you are shopping for individual coverage on the marketplace, the easiest way to find out if you're in a state that has federal coverage or their own state set up for it is to go to healthcare.gov, put in your zip code or your state, and they'll tell you where to go from there.
Thanks to last month's passage of the Inflation Reduction Act, the enhanced subsidies that were first adopted under the American Rescue Plan Act, a bill that was more commonly known as the COVID relief bill, well, those subsidies have been extended. What does this mean for the price that people will pay for health insurance they purchase through the federal government health insurance marketplace or the individual state health insurance marketplaces?
It means that the help that you've gotten with cost since those subsidies were put in place during the COVID emergency will continue. So you will continue to get access to those cost sharing benefits or tax credits that you have been getting since that relief came through.
And those extended or enhanced subsidies are in place now for the next 3 years, which is great news.
Amazing. Yes.
You know, hundreds of thousands of people who are living with MS are on Medicare. So let's talk about Medicare for a moment. First, tell me about the MS Navigator services that are going to be offered during Medicare open enrollment.
Yeah, absolutely. Okay. So there is a team of navigators that are called the Benefits and Employment Specialty Team, and we offer a specialized service for individuals who are already on Medicare, so already Medicare beneficiaries for open enrollment. And what you can do is after or starting on October 3rd, give us a call, the 1-800 number, and ask for an open enrollment appointment. One of the intake specialists will get you over to our team and we'll set up a specific day and window of time where we will sit with you over the phone and use the Medicare Plan Finder search tool on Medicare.gov to plunk in your specific information, your prescriptions, and we will help you narrow down plan options so that you're making an informed choice for 2023. That's
amazing. Is Medicare open enrollment for people who are new to Medicare, or is it for people who are already on Medicare?
It is for the individuals that are already on Medicare, because the people that are new to Medicare actually have a larger window to be able to assess and make their Medicare decisions. So even if your Medicare starts, your enrollment, your first enrollment for Medicare as a new to Medicare beneficiary starts on January 1st, you are not restricted by the open enrollment dates. You actually have what's called your initial enrollment. And that's actually 7 months long. It's the 3 months before your initial or your month of enrollment, the entire month of your enrollment, and then 3 months after. So we will still help you if you're new to Medicare, but we want to leave these appointment slots for our open enrollment people that have a shorter window. And we will spend a lot of time with individuals, as much time as you need with individuals that are new to Medicare, to make sure that you are understanding this new world that you're joining.
I'm hoping you can clarify something that I know confuses a lot of people. Can you explain the difference between original Medicare and Medicare Advantage plans?
Okay. So Original Medicare is a government or a federally run program that has three main parts to it. You've got the first part, Medicare Part A, is part of Original Medicare. And you see it referred to or hear referred to as hospital coverage, but I feel like a better way to think about it is inpatient coverage. And then there's another part that's Medicare Part D. I think of it as D for drugs. That's the coverage that you choose to help you with the cost of medications that you ingest yourself, that you give to yourself. And then everything else, as far as medical services go, is covered under Medicare Part B. So you've got D for drugs, A for inpatient, and then Medicare Part B for everything else. So that's Original Medicare right there. Medicare Advantage is a privatized version of Medicare. So you can choose to take a different path away from Original Medicare and sign on to a policy that is set up by a private health insurance company that has proven that their coverage is going to be equivalent to what you would get with Original Medicare. And you can choose to go with that private version of Medicare instead. So it's complicated. It's such a big, messy puzzle, and there's so many solutions to it that it can be hard to summarize.
Oh, I understand. I know that during the open enrollment period, TV seems to be bombarded with commercials, and they're all for Medicare Advantage plans.
Right.
Some of my listeners may be wondering, why would a company promote those? And I will only point out what has been made public about those Medicare Advantage plans. They are most often the single largest profit centers for private insurance companies. So the reason they want to invest all that money in all those TV commercials is they make a lot of money on Medicare Advantage plans.
Well, and I think a lot of times that these advertisements will be for a Medicare Advantage plan that says that it's $0 premium. And they say that it's essentially are trying to make the point that it's free. But no matter what, you're still paying your Medicare Part B premium. You're just paying it to Original Medicare if you do Original Medicare, or it's going to that privatized health insurance policy then instead. And then they advertise the plans with the big bells and whistles on them that not every plan offers once you give a call to them.
Well, if someone wants help or has questions about open enrollment, and I could see why you would have some questions, it can get confusing. How can they contact an MS Navigator?
The best way is to give a call to our 1-800 number, 1-800-344-4867. It also spells 1-800-FIGHT-MS. You can give a call, and like I said, our intake specialist will get you over and we'll set up an appointment. You can email, contact us, nmss@nmss.org, and we will email back and forth with you to figure out a way to set up an appointment too.
You already know that I'm a fan. I think the MS Navigator program is amazing. But I'm just wondering, are there things that an MS Navigator can't help with during open enrollment? Yeah.
Two things come to mind. First, with the marketplace, we do get requests to do a similar kind of plan search on the marketplace, or be able to compare and contrast plans in the marketplace for individuals. We can't do that because we just wouldn't be as good at it as what you would get if you were to work with either a local assister or a local navigator that's found on the healthcare.gov website under the Find Local Help tab. Those individuals are going to have in-depth knowledge about the plans and policies that are specific to your state's marketplace or the federal marketplace. And then the other question that I feel like we get a lot is that individuals want us to be able to tell them what company or what policy is best for individuals with MS. And it's really important for everybody to acknowledge that you are an individual. Your MS is not going to be the same as the next person's MS. Your personal preferences or priorities aren't determined by your MS. They're part of your personality. And so that's going to vary depending on, in effect, what insurance is going to be best for you. So what our goal for everybody is to get you the resources and the information so that you can make an informed choice for your best options.
If someone is setting out to make the best health insurance decisions for themselves, can you recommend any specific tools or other resources that they can use?
Yeah, I'm gonna spout off 3 really good self-service pages that we've developed on our website. Our team that works on Medicare especially worked on these to try and make them have the answer to any question that we could provide guidance on. So the first one, when we're talking about open enrollment, the next couple months, is at nationalmssociety.org/open enrollment. The next one is if you are already in your policy and you've made the choice, but you're coming across issues around cost for your disease-modifying therapy or MS-related medication, we have a website that is going to get you through any possible resource that could be out there to help you with those costs. And that is nationalmssociety.org/RX help. R is in Robert, X is in X-ray, help. And then the last one, if you're at the beginning of assessing what your health insurance options are, and you want to make sure that you didn't miss out on some possible source or resource for accessing or getting into that health insurance coverage, you can go to nationalmssociety.org/get covered. So those are 3 websites with a ton of tools and resources embedded in them that can hopefully answer any question they have.
Nicole Vasquez, thank you for making a difference every day in the lives of people affected by MS. And thanks for talking with me today.
Of course.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/268. You'll find that link in today's show notes so you can easily copy and paste it right into your email or text. And if you have a minute, I hope you'll visit the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes, and it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.